Hey, are you looking for a delicious way to boost your immune system? Meet Sufficient C, the crave-worthy immune support drink that makes staying healthy a treat, not a chore. Packed with 4,000 milligrams of non-GMO vitamin C, Sufficient C is more than just a drink. It's a powerhouse of immune-boosting goodness. With added L-lysine, bromelain, and 96% pure caffeine-free green tea extract, every sip is a step towards better health. And the best part, it tastes amazing. Our lemon peach immune aid mix is sweetened with pure stevia, no sugar, no guilt. Plus, it's plant-based, gluten-free, kosher, and completely caffeine-free. So why settle for boring when you can have a flavorful immune-boosting refreshment? Visit sufficiency.com and mix up your health routine with Sufficiency, because your health deserves a delicious boost.
This is the Real Health Podcast, brought to you by Riordan Clinic. Our mission is to bring you the latest information and top experts in functional and integrative medicine to help you make informed decisions on your path to real health.
Well, welcome everyone to another edition of the Riordan Clinic podcast, Real Health Podcast. I'm Dr. Ron Hunninghake. I've got it as my guest today, Dr. Thomas Levy, a really good friend of mine and friend of the Riordan Clinic and a friend of many people who seek his advice on nutrition and the dental connection to health. Oh my gosh, and today we're going to be jumping into the discussion of biofilms. And I was trying to think back the first time. I've known Dr. Tom for many years. It seems like we were in South America giving a lecture somewhere, and you started talking about dental biofilms and how it's one of the most overlooked, most important subjects that people could possibly get into. And I thought, wow, dental biofilms, why are they so important? What's your story on that?
Well, I think the first thing to make clear to anybody taking the time to listen to us today, Dr. Ron, is to know what a biofilm is.
Yes.
And a biofilm, in a nutshell, is very interesting, is whenever pathogens, often bacteria, but also viruses too, stop circulating freely in the blood or the lymphatic fluids and attach to a physical surface, mucous membrane, whatever, literally within 24 hours, they're encased with a substance called a biofilm, where they secrete the material that basically they build themselves an armor. Mm-hmm. They build themselves an armor, and it can be called that because this biofilm or pathogen-generated armor actually protects those pathogens from antibiotics. And it's well established in the literature, but maybe not well acknowledged, that once you have pathogens covered by a biofilm, there's not a single antibiotic in existence that will wipe out the pathogens. So once you have pathogens clinging to a mucosal surface or an epithelial surface or another area in the body, can be in the mouth, can be around the teeth, can be in the upper airways and in the nose and throat, it's going to stay there. It's going to stay there. And the nasty part about that is oftentimes, well, more often than not, when you have pathogens in your nose and throat or in your teeth or in your oral cavity and they're covered by a biofilm, they're asymptomatic. You don't know. In other words, it doesn't just happen if you have a cold or something like that or you feel bad. These pathogens, this is sort of their natural environment, is to get in there, colonize, and just set up shop indefinitely. They're not proliferating rapidly so that you have a overt infection like the flu or something like that. They're just sort of steady state. They're just doing what they need to do. And this then creates the real problem with biofilms is the metabolism of the pathogens. The pathogens, even though they're growing much more slowly, they're continually generating pro-oxidant toxic, aka toxic, pro-oxidant metabolic byproducts as the metabolism goes. And then when the pathogen itself finally does die, because it still has a lifespan like anything else, and it breaks down and ruptures. That's more pro-oxidant stuff, and it's filled with iron. People might not know, but most pathogens thrive on iron, and the more iron that's present, the more rapid the pathogen grows. But the point being is once the pathogen dies, it's like rupturing a little sack of free iron. And we've talked in the past about how toxic iron is, and if anybody listening doesn't realize that, iron is one of the most toxic things that you can take in your body beyond the precise level that you need. Okay, above that, highly toxic. Like copper, above that, highly toxic. Calcium, above that, highly toxic. What I call the 3 toxic nutrients. So that's more or less a little encapsulation, if you will, of the biofilm story.
Fantastic. And what that makes me think of is why vitamin C is so important. Because vitamin C, when it goes intracellular, it will generate the hydroxyl radical in the presence of the iron. So when people say, why is vitamin C so effective against infections? And I would hope that it would be effective against biofilms for this very reason. The accumulation of iron will help the vitamin C to generate more peroxide, which will help break through this barrier that the pathogens form around themselves. I don't know, am I off key on that? Or
no, that's a very interesting point too, because hydrogen peroxide, pure and simple, along with other things like DMSO, but let's not get into that. But hydrogen peroxide, which we've talked about in the past, is easily disrupts and eliminates biofilms and then easily can kill the pathogens. And what you just said there brings up the good point. The excellent possibility is that taking the vitamin C then stimulates the endogenous form, the endogenous production of the hydrogen peroxide that can help it do that. I'll be candid and say in my research on biofilms in the Rapid Virus Recovery book, I did not specifically look in the literature, does vitamin C disrupt biofilms? So I can't give a yes or no answer to that, except to say that clinically, I would say it does. Mm-hmm. That's what we've seen. But certainly the role that it plays, when you take in a large dose of vitamin C, like you do at the Riordan Clinic, 25 grams, 50 grams infusion, a lot of it goes straight into the cell, okay, providing an electron source for ferric ion to go to ferrous ion, and then the ferrous ion contributes the electron to hydrogen peroxide, which makes hydroxyl radical and ruptures the pathogen of the cell. But at the same time that's happening, the large amount of vitamin C that you're taking, by mechanisms I don't understand or know, but it's a fact that large amounts of vitamin C in the extracellular space before it gets into the cell also generates new extracellular hydrogen peroxide production, which then is free to diffuse inside the cell. So you keep all the facets of that Fenton reaction, that's what we're calling it, Fenton reaction, mm-hmm. going until the pathogen is completely gone. And to make it even more elegant, the more hydrogen peroxide you put inside the cell, the more you mobilize new ferric ion from its ferritin storage sites. So then you keep all 3 components of the Fenton reaction queued up with a large amount of vitamin C, and then you have the iron, and then you have the peroxide, and then you have the hydroxyl ion. So as you well know, with your background, Dr. Ron, there's a lot of chemical reactions, and they do a lot of things, but if you want to do them until the job is done, you need to make sure each part of that chemical reaction continues to get new supply of material to work on.
A lot of people are using peroxide for teeth whitening, and I'm wondering if that's a good thing for what we're talking about here, because I know you've had extensive experience working in the dental field, and sometimes it's hard to get people to realize how important the care of their teeth really is. And does hydrogen peroxide taken orally, not swallowed, but gargling with it and swishing it around, is this a good idea to help prevent dental biofilms?
Absolutely, no question. Matter of fact, that's probably the cheapest and easiest and most effective. There's the big 3 for you: cheap, easy, and effective.
Right.
way to deal with that. And it also goes a long way toward helping to prevent new recolonization of your nose and throat with new pathogens that you get exposed to. Because I just talked about what happens when you swallow these things and you disrupt the digestion and the microbiome, and then you start absorbing toxins and other pathogens, all because you've been swallowing toxins from these growing pathogens.
One of the most interesting things that came out of the pandemic, I don't know if people know, but you wrote the book on how to deal with that using nebulization, hydrogen peroxide nebulization. One of the things that you told me is one of your people that got the book started using it. His diarrhea of 20 years went away. How does that play into the whole biofilm question? Because I'm thinking there's got to be something he had in his nose and sinuses that he was swallowing that was perpetuating the bad bacteria in the gut. And by cleaning that up, maybe that's what got him out of that cycle.
Absolutely. I don't think there's any question about it. As a matter of fact, when I was writing Rapid Virus Recovery and at the beginning of 2021, obviously I wanted to make an impact on doing as much as I can to slow down or stop the pandemic by getting this information out. But I was observing so many phenomenal things on the positive effect on the gut. I almost called the book Rapid Gut Recovery by hydrogen peroxide. But I said, no, that'll just be confusing to people. Let's just keep it Rapid Virus Recovery. But it's my conviction, based on what I've seen, the feedback that I've gotten from patients, the pathophysiology and physiology that I've outlined in the book Rapid Virus Recovery, is that, like I said, unless you do an intervention with something like peroxide, if you had a cold or a flu or any other relatively minor ailment any time in your past, 6 months ago, 6 years ago, 16 years ago, and you never took an intervention that could penetrate the biofilms we're talking about, because they can stay there and they'll live with you entire your life.
Wow.
Okay, so unless you did something after you had a cold 15 years ago to strip out the biofilms and kill the pathogens that are growing on your nose and throat, you will continue to swallow these toxic byproducts from the pathogen colonization. And that's exactly what happens. I have had the feedback. The diarrhea, which you just mentioned, that's impressive. But guess what? I had a lady write me and said, my son's been critically ill and bedridden with Crohn's disease for over 2 years now. He can't get out of bed. He's weak, this, that, or the other. Bottom line is, with just some regular supplementation, nothing too overwhelmingly impressive, he started the peroxide nebulization, and within, I think, 2 or 3 months, he was completely normal. Now, you certainly know Crohn's is, quote unquote, a lifetime incurable disease. Well, he got out of bed. He became an athlete at school, started gaining weight because he was kind of scrawny at the time. Another lady wrote me like this that had black mold poisoning, her and her entire family. And without going into great detail, she said when they started nebulizing the hydrogen peroxide, it all disappeared. I had another couple ladies tell me about irritable bowel syndrome, very similar to what you're talking about with the diarrhea. They'd had it for months. Just being on the peroxide nebulization for a week or two, no more irritable bowel. And this all started, let me be candid, I started messing with nebulization long before the pandemic, about 7 or 8 years ago, doing the research for my magnesium book. And I never thought about nebulization, but I'd had sinus problems my whole life. And I saw in magnesium, well, you can nebulize magnesium. Oh, you can nebulize vitamin C. Oh, you can nebulize many other things. And I additionally saw peroxide. And I said, well, I always knew that peroxide was a tremendous antipathogen. So one day, I nebulized peroxide for, 10 or 15 minutes. No big deal, just fine. And the next day, I had the most incredible, perfect bowel movement of my life. And I was about 66 at that time. So I'd had a few BMs in my life, and none of them were like this. So I said, my goodness, this is what happens when you give the gut enough of a chance to recover. Because although that was really rapid, many other conditions resolve quickly because you have intestinal stem cells that basically give you a new lining in your gut every 3 or 4 days.
Right.
So if you stop poisoning them, you could basically have a new gut in a week. All right. And then after that, when the microbiome changes, the leaky gut heals up. And as you well know, once you stop this horrible contribution of pathogens and toxins coming from a lousy gut, everything gets better. And of course, we see the lines in the drugstores, all the different lotions and potions for diarrhea, constipation, gas, flatulence. If I'm oversimplifying this, it's not by too much, because when you stop this stuff, it's amazing how well the gut does. Also, I want to add too, babies. I just saw in rich food, they add metallic iron filings.
Oh, jeez.
Even if they added regular iron, that'd be bad. Supplemental iron. And I saw in just like you've seen, just running a magnet through the infant oatmeal, I believe it was, you could pick up the iron filings. Ugh. Does anybody wonder why the baby gets an upset stomach so often? Why it needs to be burped?
Yeah.
Okay.
Yeah.
I mean, you're lucky your babies are surviving. Okay. So I wasn't going to go in this direction, but I mean, that's another toxic contribution to all the chronic bowel problems. Because the bottom line is, most people do not eat organic. Okay. And organic, most of the time, is going to leave you free from this horrible supplementation they put in our foods. And because they can't afford it, for one thing. All right. Economy's tight everywhere. But when you're eating a metallic form of a metal in every meal that you eat, not only do you have a pro-oxidant effect in your gut, guess what else you have? Foreign body reactions. Yeah. All right. When you put something, then you get a local inflammation to kind of wall that off. So there's just so many horrible things that happen. But if we just leave our damn food, or they would leave our damn food alone, we do a whole lot better.
Yeah. I kept thinking about all the patients I've seen over the years with chronic sinus infections, and oftentimes what they get is round after round of antibiotics, which really don't penetrate, as you mentioned, do not penetrate the biofilms. But then the other thing is they're swallowing that stuff too. So that's what you're saying about how what's happening in the sinuses can affect what's happening in the gut. But for people, if they want to get over a chronic sinus problem, they're going to need to think about some kind of peroxide spray or something to get peroxide up there. If you try, you obviously you have to be careful with it. But
and the most important thing they need to do, the chronic sinusitis sufferer, they need to get the 3D cone beam exam of the mouth, because, and this actually stunned me when I first saw it, and then when I thought about it a while, it wasn't that amazing, because people that get chronic sinus infections, they just kind of keep them forever, right?
Yeah.
Well, if you have an asymptomatic infected tooth, it doesn't hurt you, you keep it forever. 70% of patients with chronic sinus problems had one or more infected teeth in the upper jawbone. So, I mean, with the upper jawbone, it's the bottom of the tooth that's directly abutting the sinus. So you have a little infected pocket right there, continually, oftentimes eroding away the bony floor of the sinus completely and putting the infected products directly into the sinus. So, but if that's ruled out, then you need to work on the other stuff. But the other thing too, not too much time to talk about it, is if you've ruled out these chronic provocative reasons for having an infection like sinusitis, and you still have it, a lot of times that's adrenal insufficiency. Okay, you're just not getting enough vitamin C inside your cells to keep a normal state. And as we've talked about, cortisol that your adrenal glands naturally make, Arguably, in my opinion, based on the sciences that I've reviewed, is that the primary purpose of cortisol and hydrocortisone is to push vitamin C inside the cells. Okay, so when you don't have enough cortisol, the characteristics of somebody adrenally insufficient is continued repeated infections. They just can't prevent from having infections. But once you hit them with vitamin C and with cortisol, and we've talked about this, this is not steroid therapy. This is orthomolecular hormone replacement, okay? And there's nothing to be afraid of as a physician or as the patient being prescribed for to take variable doses of cortisol, especially when you see it start to eliminate your infections, which is just a direct documentation that you've been cortisol insufficient for quite a long time.
People who are chronically ill with sinus infections or any kind of infections, they tend to be tired all the time. And when we check their cortisol levels, they're low. They may not be totally in the abnormal range, but they're in the low normal range. And unless you give them some kind of adaptogen or the biological hydrocortisone, most people, when you say cortisone, what they've been given is prednisone. And
right.
1 milligram of
oranges, as you
1
will,
milligram of
oranges.
prednisone is like 5 milligrams of hydrocortisone. So if you're having 5 to 10 or 15 or 20 milligrams of hydrocortisone, that's only like 3 to 4 milligrams of prednisone. So most doctors give 20 to 40 milligrams of prednisone when they give it. So they're like overshooting, and then you get the side effects of too much cortisone. So it's kind of giving cortisol a bad name.
Right. No doubt about it. I mean, and the thing is prednisone, methylprednisolone, Decadron, all of those synthetic corticosteroids, these are not made by your body. These were made in a laboratory. They're what I call sledgehammers. Okay. I mean, the cortisol just massages the vitamin C into the cell. The other thing too, we have so little time, but the other thing too is, as you well know, your liver should be making vitamin C around the clock. And when you have a stress reaction, your liver should make more vitamin C. At the same time, it makes more cortisol. Why? Because the vitamin C and the cortisol meet in the blood, go inside the immune cells, and go toward the site of inflammation for your acute immune response. So, but when you take prednisone or something like that, you do not only are you hitting it too hard, but in the human being that has lost the ability to make the vitamin C from glucose, then the glucose accumulates. And the prednisone does something called gluconeogenesis, starts making even more glucose while using up the protein in your muscles. So that's why you have the long-term steroid problem of muscle wasting and diabetes, which you will not see, never see, with cortisol and vitamin C taken together.
Wow. It's amazing. We started with biofilm and we ended up, with iron filings and the nasal, the things that we're swallowing from our infected sinuses causing our Crohn's disease. It's all tied together though.
It's all tied together.
But people need to kind of understand it in the context of the whole being and what we can do to help ourselves. But back to the simple point, if people would do a better job of breaking down biofilms in their mouth, that would solve a lot of health problems, not just dental problems, but overall health problems. So,
and that's where you were talking about gargling with peroxide and all, which is good, but probably just about the best thing you can do for long-term dental health, which means long-term general health, of course, is regular water picking with hydrogen peroxide. I mean, not pure hydrogen peroxide, but a container, warm water, and then you add maybe 30 or 40 cc's of 3% hydrogen peroxide, maybe some mouthwash if you want a flavor to it. And this is the way that gets in there, okay? Yeah. A lot of it not only will kill the pathogens, but it will disrupt the biofilm. So you're going to disrupt the biofilm, kill the pathogens, and that is ultimately, might be oversimplifying, but not that much. That is ultimately the reason why you get all dental disease, is you never get infected teeth, infected tonsils with healthy gums. It all starts with the gums. I mean, the teeth are sitting in the gums, and then as they become infected, they start breaking down the attachment between the periodontium, the gum tissue, and the tooth until they reach the tip of the tooth. Then into the pulp of the tooth, you have an infected tooth, and you're no longer doing well. But infected teeth, which then lead to the infected tonsils, which we've not talked about, but that's important too.
Right. Okay, last word. Are there, besides vitamin C, are there any other herbal remedies or natural remedies that help with the body's constant conflict with biofilms? Because I think it's almost like the germs want to use us as a home, unfortunately. What can we do to prevent that?
Well, anytime you have a cold or flu or something, or any sort of upper respiratory tract infection, you still do need, in my opinion, to go through some degree of peroxide nebulization to reset the pathogens inside there, because hydrogen peroxide will do it. I believe chlorine dioxide will do it.
Yeah.
But I don't generally go after chlorine dioxide because it has a bleach smell to it. And I think a lot of people would only get turned off by the smell, but they would also reach the conclusion that you're doing something horrible to the body by giving it something that smells like bleach. We've had all this hysteria in the press before, even though, guess what? Chlorine dioxide is also made in your body, just like hydrogen peroxide is made in your body. So some agent like that to sort of reset things and then proceed from there. And of course, the rest of it is then to maintain prophylactically, preventatively, as non-infective a state as you can, with, of course, all our biooxidative therapies and the vitamin C, the good supplementation. Let me give them all my Super 8 supplements.
All right, good.
Okay. Multigram vitamin C, multigram magnesium, vitamin D3 to get you above 50 nanogram per cc, vitamin K2. These help normalize calcium.
Yep.
Then the other four help upregulate ATP, which makes everything in every cell in your body better. That's multigram or at least 1 gram niacinamide, 400 milligrams of vitamin K2 riboflavin, as much as a gram. I like to be aggressive with this one, even though it's a little costlier, as much as a gram a day of coenzyme Q10, and then 10 to 20 to 30 milligrams of methylene blue a day. All of those rapidly upregulate ATP. And when you're high in ATP, you're high in energy. When you're low in ATP, you're low in energy. And when your ATP is really low, you've got nothing left to be energetic about. AKA dead.
Dead. Dr. Tom, thank you so much for another exciting show. I mean, it's amazing what people can learn by just some simple basics and what they can do for themselves to take better care and stay out of the sickness crowd and live life in a vibrant way. So thank you so much for being on our show.
My pleasure, sir. You take care.
You too.
Thank you for listening to the Real Health Podcast. If you enjoyed this episode, be sure to subscribe and leave us a review. You can also find all of the episodes and show notes over at realhealthpodcast.org. Also, be sure to visit riordanclinic.org, where you will find hundreds of videos and articles to help you create your own version of real health.